Welcome to Drona Institute of Ayurvedic Studies, Ayurvijnana series, a series of Ayush-related general knowledge questions. Question number 41. Memorandum of Understanding was signed by Marbism under NCISM and Dash for rating of Ayurveda, Siddha and Unani colleges for the academic session 2025-26 on 28 April 2025. The options are option A, National Institute of Ayurveda, option B, Quality Council of India, option C, Central Council for Research in Ayurvedic Sciences, option D, All India Institute of Ayurveda. The correct answer is option B, Quality Council of India. The Quality Council of India was established as a national body for accreditation, and the slogan of QCI is creating an ecosystem for quality. And it was set up as an independent autonomous organization with the support of Government of India and the Indian industry, represented by the three premier industry associations such as Associated Chambers of Commerce and Industry of India, short named as ASSOCHAM, Confederation of Indian Industry, CII, Federation of Indian Chambers of Commerce and Industry, FICCI. And the Quality Council of India have 5 constituent boards, and they are NABL, NABH, NABCB, NABET, and MBQP. NABL is National Accreditation Board for Testing and Calibration of Laboratories, and NABH is National Accreditation Board for Hospitals and Healthcare Providers. NABCB is National Accreditation Board for Certification Bodies, and NABET is National Accreditation Board for Education and Training, and NABQP is National Board for Quality Promotion. And the chairperson of Quality Council of India is Mr. Jagshesh, and the Secretary General is Mr. Chakravarti G. Kannan. Question number 42. Traditional Knowledge Digital Library is a joint collaboration of option A, CCRAs and Ministry of Ayush, option B, ICMR and Ministry of Ayush, option C, CSIR and Ministry of Ayush, option D, ICAR and Ministry of Ayush. The correct answer is option C, CSIR and Ministry of Ayush. TKDL is Traditional Knowledge Digital Library, and it is a joint collaboration of the Council of Scientific and Industrial Research, CSIR, and Ministry of Ayush, established in 2001. The objective is to prevent exploitation and to protect Indian traditional knowledge at patent offices worldwide. India's traditional medicinal knowledge exists in languages such as Sanskrit, Hindi, Arabic, Urdu, and Tamil. And Indian traditional knowledge, even documented, is neither accessible nor understandable by patent examiners at patent offices worldwide. And Traditional Knowledge Digital Library has overcome the language and format barrier by systematically and scientifically converting and structuring the available contents of the ancient text on Ayush into 5 international languages, and they are English, Japanese, French, German, and Spanish. TKDL acts as a bridge between formulation existing in local languages and a patent examiner at a global level, as the database will provide information on modern as well as local names in a language and format understandable to the patent examiners. 4.54 lakh examinations and practices have been transcribed into the Traditional Knowledge Digital Library database, and 324 patent applications have either been set aside or withdrawn or amended based on the prior art evidences present in the TKDL database. And as per the approval of Cabinet Committee on Economic Affairs, access of Traditional Knowledge Digital Library is available to 16 patent offices, and they are European Patent Office, United States Patent and Trademark Office, Japan Patent Office, United Kingdom Patent Office, Canadian Intellectual Property Office, German Patent Office, Intellectual Property Australia, Indian Patent Office, Chile Patent Office, Intellectual Property Corporation of Malaysia, Rose Patent Intellectual Property Office of Russia, Peru Patent Office, Spanish Patent and Trademark Office, Danish Patent and Trademark Office, National Industrial Property Institute France, Eurasian Patent Office. And the TKDL is the first of its kind prior art database globally, and it has proven to be an effective deterrent against biopiracy. Question number 43. The first exclusive All India survey on Ayush as a part of National Sample Survey was conducted by option A, CCRAS, option B, NSSO, option C, QCI, option D, WHO. The correct answer is option B, NSSO. NSSO is National Sample Survey Office. The first exclusive All India survey on Ayush was conducted by National Sample Survey Office as a part of National Sample Survey, And All India Eye Survey was conducted by National Sample Survey Office during July 2022 to June 2023 as a part of 79th round of National Sample Survey. The survey covered the entire Indian Union, except Andaman and Nicobar Islands, in which information was collected from 1,81,298 households. And the objective of the survey is awareness of people about the traditional system of healthcare, namely Ayush, uses of Ayush for prevention or treatment of ailments and for prenatal and postnatal care, awareness of the households about home remedies, medicinal plants, local health tradition, and folk medicine, information on expenditure incurred by households on availing treatments using Ayush system of medicine. And in the survey, a member of the household aged 15 years or more is considered as aware of Ayush if he or she has taken treatment using Ayush anytime, is aware about medicinal plants, home remedies, and traditional practices for the treatment or prevention of ailments, and is or was engaged by profession to Ayush or has heard about at least one of the Ayush system. Question number 44. WHO M Yoga app was launched by option A Sri Narendra Modi, option B Vaidya Rajesh Kotecha, option C Dr. Tedros Adhanom Ghebreyesus, option D Sri Sarbananda Sonowal. The correct answer is option A Sri Narendra Modi. Prime Minister of India Sri Narendra Modi launched the WHO M Yoga app while addressing on the occasion of 7th International Day of Yoga in 2021. World Health Organization has developed M Yoga app with the support of Ministry of Ayush and Morarji Desai National Institute of Yoga. And M Yoga is a mobile platform app which has yoga protocol for general wellness, and it is an app for the general public to use regularly, providing yoga learning and practice sessions. And M Yoga app is a do-it-yourself DIY companion with a collection of videos and audio practical sessions. WHO M Yoga app can be used as a daily yoga companion for persons aged 12 to 65 years. It is available in both English and Hindi, and it is available for free download on Android and iOS. Users can start sessions immediately post registering or logging into WHO M Yoga app, and the app's multiple user-friendly modules are designed as 10, 20, and 45-minute episodes for different levels of benefits and availability of time. The learning modules enable individuals to first learn specific postures and subsequently follow practice modules. And WHO M Yoga app has the potential to synergize efforts to promote physical activity and mental well-being under Fit India Mission, Ayushman Bharat Health and Wellness Center, School Health Program of Ayushman Bharat, and integration of National Non-Communicable Disease and Ayush programs under Ministry of Health and Family Welfare. Question number 45. Standard treatment guidelines on management of metabolic disorders in the Ayurveda system of medicine was published in 2025 by option A, All India Institute of Ayurveda, option B, Ministry of Ayush, option C, CCRAS, option D, Ayush Vertical, DGHS. The correct answer is Ayush Vertical, DGHS. The standard treatment guidelines on management of metabolic disorders in the Ayurveda system of medicine was published by Ayush Vertical under Directorate General of Health Services, and it was published in April 2025. The guidelines were released during National Ayush Mission Conclave 2025 held at Kaivalya Dama, Lonavala. And the standard treatment guidelines on management of metabolic disorders covers 5 major metabolic disorders, and they are diabetes mellitus, obesity, gout, non-alcoholic fatty liver disease, and dyslipidemia. And the consultant editor is Dr. Adul Goyal, Director General of Health Services, and executive editors are Vaidya Rabinarayan Acharya, who is the Director General at CCRAS, and Dr. A. Raghu, Deputy Director General, Ayush Vertical, DGHS. A national expert committee was constituted for publishing the management of metabolic disorders in Ayush system of medicine. Question number 46. E-Samhita was designed and developed by option A, National Institute of Ayurveda, option B, All India Institute of Ayurveda, option C, National Institute of Indian Medical Heritage, option C, Institute for Teaching and Research in Ayurveda. The correct answer is option C, National Institute of Indian Medical Heritage. E-Samhita was designed and developed by National Institute of Indian Medical Heritage, Hyderabad, and it is an e-book of Ayurveda Samhitas. An e-book is defined as an electronic version of a book which can be read on a personal computer or a handheld device designed specifically for this purpose. An e-Samhita is the first of its kind developed for an Ayurvedic text, and it is a powerful combination of electronic book, full text search enabled, keyword in the context KWIC module. And it is equipped with Devanagari, Telugu, Malayalam, Tamil, Gujarati, Kannada, and Bengali languages. E-Samhita is available in the form of E-Sustra Samhita, E-Charaka Samhita, E-Madhavanidhana, and E-Nigandu. Due to the presence of search tool option, it is easy to go to the reference directly in a short time, and it is available in the CD form and is cost effective and easy to carry or portable. The National Institute of Indian Medical Heritage Hyderabad published the E-Samhita during the tenure of Dr. G.S. Lavekar, Director, CCRAS, and the project coordinator is Dr. Alla Narayana, Director, National Institute of Indian Medical Heritage Hyderabad. The project co-coordinator is Dr. Bhuvanesh Kumar Sharma, who is Research Officer in National Institute of Indian Medical Heritage Hyderabad. Question number 47. E-Aushadhi portal for online licensing system of Ayush medicine was launched by option A, Sri Sarbanand Sonowal, option B, Sri Pradap Rao Jadhav, option C, Sri Sripad Ashok Naik, and option D, Vaidya Rajesh Kotecha. The correct answer is option C, Sri Sripad Ashok Naik. E-Aushadhi is Ayurveda, Unani, Siddha, Homeopathy, Automated Drug Help Initiative. It is a portal for online licensing of Ayurveda, Siddha, Unani, and homeopathic drugs. It was launched by Sri Sripad Ashok Naik, Minister of State for Ayush, Government of India, on 13th February 2019. E-Aushadhi portal will aid the licensing authority, manufacturers, and consumers, as it will provide real-time information of licensed manufacturers and their products, cancelled and spurious drugs, contact details of the concerned authority for specific grievances. In E-Aushadhi, timelines will be fixed for processing of application through this portal with SMS and email status updates at each step of the process. E-Aushadhi is a reflection of India government's commitment towards e-governance, ease of doing business, and Make in India. Question number 48. Which of the following is not a part of Yoga Break at Workplace protocol prepared by Morarji Desai National Institute of Yoga? Option A, Brahmari Pranayama. Option B, Nadi Shodhana Pranayama. Option C, Surya Vedana Pranayama. Option D, Dhyana. The correct answer is option C, Surya Vedana Pranayama. Why break? The Yoga Break at Workplace Yoga protocol was devised with an aim to get de-stressed, refreshed, and refocused. And it is done to enhance immunity at the workplace by practicing selected yoga practices for short duration to get the benefits as projected from yoga practice for a longer duration. And the Y break protocol or yoga break at workplace comprises few simple yogic practices such as Tadasana, Urdhva Hasta Uttanasana and Tadasana, Skanda Chakra, Uttana Mandugasana and Kadi Chakrasana, Nadi Shodhana Pranayama, Brahmari Pranayama and Dhyana, Ardha Chakrasana, Prasarida Pada Uttanasana and deep breathing. The Vibrate protocol was developed by three eminent yoga experts, and they are Dr. Ishwar B. Basavareddy, who was the former director of Morarji Desai National Institute of Yoga, and Dr. Mugan Vinayak Bole, who is a consultant in yoga and therapy and promoter of experiential yoga, Logamanya Medical Research Center, Pune, and former joint director of Research K. Samiti Lonavala, and Mr. S. Sridharan, who is eminent yoga expert and senior mentor, Krishnamacharya Yoga Mandiram, Chennai. The Vibrate protocol can be practiced by people from factory workers to intellectuals in academic field, and it is done for 5 minutes twice a day and during the day with a prolonged work schedule. Vibrate at workplace can create a perfect balance between the activities and process of body and mind. Question number 49. The CCRS drug formulation, which is formulated as a supportive therapy for the improvement of quality of life in cancer patients. Option A, Ayush SC3. Option B, Ayush QOL2C. Option C, Ayush D. And option D, Ayush QOL2A. The correct answer is Ayush QOL2C. And the explanation, Ayush SC3 is used in hemoglobinopathy conditions. Ayush QOL2C is formulated as a supportive therapy for the improvement of quality of life in cancer patients, which is the question. Ayush D is used in the management of diabetes mellitus. Ayush QL2A is formulated as a supportive therapy for the improvement of quality of life in HIV or AIDS patients. Question number 50. The CCRS drug formulation, which is used in gynecological disorders to prevent dysfunctional uterine bleeding. Option A, Ayush Manas. Option B, Ayush A. Option C, Ayush LND tablet. Option D, Ayush Rasayan A and B. The correct answer is option C, Ayush LND tablet. The explanation: Ayush LND tablet is used in gynecological disorders to prevent dysfunctional uterine bleeding. Ayush Manas is used for mental retardation. Ayush A is used in the treatment of asthma. Ayush Rasayan A and B are accelerated and appropriate nutrition to improve the biological competence of the body. Question number 51. World Health Organization Global Traditional Medicine Center, WHO GTMC, is situated at option A, Jamnagar, India, option B, New Delhi, India, option C, Manila, Philippines, and option D, Geneva, Switzerland. The correct answer is option A, Jamnagar, India. World Health Organization Global Traditional Medicine Center is a WHO headquarters department in the Division of Universal Health Coverage and Life Course outposted to Jamnagar, Gujarat, India. It was launched in 2022 with the foundational support from Government of India. And the Global Traditional Medicine Center was inaugurated by Prime Minister Sri Narendra Modi alongside WHO Director General Dr. Tedros Adhanom Ghebreyesus. And it has the following areas: Traditional Medicine Global Summit, Traditional Medicine Research and Evidence, Traditional Medicine Primary Healthcare and Universal Health Coverage, Traditional Medicine Indigenous Knowledges and Biodiversity, Traditional Medicine Digital Health Applications. And the current director ad interim of WHO Global Traditional Medicine Center is Dr. Shyama Kurivilla. And the objectives are to position Ayush systems across the globe to provide leadership on global health matters pertaining to traditional medicine, to ensure quality, safety and efficacy, accessibility and rational use of traditional medicine, to develop norms, standards and guidelines in relevant technical areas, tools and methodologies for collecting data, undertaking analytics and access impact, envisage WHO Traditional Medicine Informatics Center creating a collaborative of existing traditional medicine data banks, virtual libraries, and academic and research institutes. And to develop specific capacity building and training programs in the area of relevance to the objectives, and to conduct training programs in campus, residential or web-based, and through partnerships with the WHO Academy and other strategic partners. Question number 52. Ayurcell is related with option A, Ayurveda Career E-Logistics, option B, Ayurveda Career E-Linkage, option C, Ayurveda Clinical E-Learning, option D, Ayurveda Curative and E-Lifestyle. The correct answer is Ayurveda Clinical E-Learning. Ayurcell is Ayurveda Clinical E-Learning. Ayurcell project aims to create a web platform to make available the clinical experiences of successful Ayurveda clinicians in a digital form and format that will facilitate continuous clinical learning based on well-documented case studies. And Ayurcell is developed jointly by Amrita Center for Advanced Research in Ayurveda, ACARA, under Amrita School of Ayurveda, and Amrita Create under Amrita Vishwavidyapeetham. ACARA, Amrita Center for Advanced Research in Ayurveda, is a new initiative of Amrita Vishwavidyapeetham at the Amrita School of Ayurveda, which provides scientific backing for traditional medical practices and pave the way for development of an evidence-based integrative approach to healthcare. And Amrita Create is Amrita Center for Research in Analytics, Technologies and Education, which is an educational technology initiative pioneered by Amrita Vishwavidyapeetham. The Ayurcell project is supported and funded by Rashtriya Ayurveda Vidyapeeth, Ministry of Ayush, Government of India, and the principal investigators are Dr. P. Ramanohar, Dr. Nagarajan, and Dr. Prema Nadingandi, and the co-principal investigators are Dr. Sushma N.S. and Dr. Shama Sundaran K. And Ayurcell has an Ayurcell clinical case repository capturing real-world clinical practices, post-publication review portal, in which review of case reports published in journals are seen, and Ayurveda Case Report Preprint Archive, which is a fast-track publication of preprint versions of case reports. Question number 53. Which of the following comes under the fourfold focused areas of Yoga project jointly done by Ministry of Ayush and World Health Organization? Option A, Common Yoga Protocol for General Wellness. Option B, Yoga for Mental Health and Resilience. Option C, Yoga for Adolescents. Option D, all the above. The answer is all the above. Yoga project. Ministry of Ayush and World Health Organization had jointly undertaken Yoga project in 2019, focusing on mobile yoga. It envisaged the concept of Be Healthy, Be Mobile, BHBM, under the United Nations Sustainable Development Goals to achieve universal health coverage by 2030. In order to achieve the above objectives, a memorandum of understanding was signed in July 2019 between WHO and the Ministry of Ayush. Yoga project focused on 4 areas, and they are Common Yoga Protocol for General Wellness, Yoga for Mental Health and Resilience, Yoga for Adolescents, and Yoga for Pre-Diabetics. And WHO Yoga app is an outcome of this Yoga project. Question number 54. The first exclusive All India survey on Ayush as a part of National Sample Survey was published by Government of India. Option A, Ministry of Ayush. Option B, Ministry of Commerce. Option C, Ministry of Tourism. Option D, Ministry of Statistics and Program Implementation. The correct answer is option D, Ministry of Statistics and Program Implementation. The first exclusive All India survey on Ayush as a part of National Sample Survey was published by Ministry of Statistics and Program Implementation, Government of India, which is National Statistical Office. The first exclusive All India survey was conducted by National Sample Survey Office during July 2022 to June 2023 as a part of 79th round of National Sample Survey. And in the Ayush survey, a member of the household aged 15 years or more is considered as aware of Ayush if he or she has taken treatment using Ayush anytime, is aware about medicinal plants, home remedies, traditional practices for treatment or prevention of ailments, or is or was engaged by profession to Ayush, or has heard about at least one of the Ayush system. And the key findings of the survey are 94.7% of rural and 96% of urban populations aged 15 and above are aware of Ayush, and Ayush is predominantly used for rejuvenation. Ayush usage and expenditure are higher in urban areas, and Ayush offers cost-effective treatments with negligible side effects. And regarding yoga, about 87 lakh households in rural India and around 1.1 crore households in urban India practice pranayama, and about 70 lakh households in rural India and around 90 lakh households in urban India practice asana, and about 54 lakh households in rural India and around 76 lakh households in urban India practice meditation. Question number 55. The current Director General of Central Council for Research in Ayurvedic Sciences is option A, Dr. N.J. Muthukumar. Option B, Dr. Subhash Kaushik. Option C, Dr. Rabinarayan Acharya. Option D, Dr. Raghavendra Rao. The correct answer is option C, Dr. Rabinarayan Acharya. And these are the different central councils and their Director Generals. The Director General of Central Council for Research in Ayurvedic Sciences, CCRAS, is Vaidya Rabinarayan Acharya, which is the question. The current Director General of Central Council for Research in Yoga and Naturopathy, CCRYN, is Dr. Raghavendra Rao. The Director General of Central Council for Research in Unani Medicine, CCRUM, is Dr. N. Sahir Ahmad. The Director General of Central Council for Research in Siddha, CCRS, is Dr. N.J. Muthukumar. And the Director General of Central Council for Research in Homeopathy, CCRH, is Dr. Subhash Kaushik. Question number 56. Which of the following Central Council is having headquarters at Chennai, Tamil Nadu? Option A, Central Council for Research in Ayurvedic Sciences. Option B, Central Council for Research in Yoga and Naturopathy. Option C, Central Council for Research in Siddha. Option D, Central Council for Research in Unani Medicine. The correct answer is Central Council for Research in Siddha. The headquarters of Central Council for Research in Ayurvedic Sciences, CCRAS, Central Council for Research in Yoga and Naturopathy, CCRYN, Central Council for Research in Unani Medicine, CCRUM, and Central Council for Research in Homeopathy, CCRH, is located at New Delhi. The headquarters of Central Council for Research in Siddha, CCRS, is located at Chennai, Tamil Nadu. Question number 57. The constituent body of Quality Council of India, which have prepared the framework for assessment and rating of Ayurveda colleges and done assessment for the academic session 2024-25 in collaboration with NCISM MABISM is option A NABH, option B NABL, option C NABET, option D NABCB. The correct answer is option C NABET, NABET. QCI is the Quality Council of India, which was established as a national body for accreditation, and it has 5 constituent boards, namely NABL, NABH, NABCB, NABET, and NBQP. And NABET, NABET, National Accreditation Board for Education and Training, is a constituent board of Quality Council of India, and it has established a mechanism for the accredited certification of educational organizations, vocational training organizations, and for accreditation of skill certification bodies. And QCI NABET has prepared the framework for assessment and rating of Ayurveda colleges and data capturing format and done the assessment for academic session 2024-25 in consultation with NCISM MABISM and published the rankings. Question number 58. CSIR TKDL unit has signed a non-disclosure agreement with the Dash for evaluating and identifying modalities for inclusion of information from the People's Biodiversity Register (PBR) into the TKDL database. Option A, Ministry of Ayush. Option B, Central Council for Research in Ayurvedic Sciences. Option C, National Medicinal Plants Board. Option D, National Biodiversity Authority. The correct answer is option D, National Biodiversity Authority. TKDL is Traditional Knowledge Digital Library, which is a joint collaboration of Council of Scientific and Industrial Research (CSIR) and Ministry of Ayush, established in 2001. And the objective of TKDL is to prevent exploitation and to protect Indian traditional knowledge at patent offices worldwide. National Biodiversity Authority is preparing People's Biodiversity Register (PBR) as per the National Biological Diversity Act 2002 and Rules 2004. And People Biodiversity Register is a tool for formal recording and maintenance of comprehensive information on availability and knowledge of local biological resources, their medicinal or any other traditional knowledge associated with them. And as per the National Biological Diversity Act 2002, approval of the National Biodiversity Authority is necessary before seeking any IPR based on biological material and associated knowledge obtained from India. And the CSIR Traditional Knowledge Digital Library Unit has signed a non-disclosure agreement with the National Biodiversity Authority for evaluating and identifying modalities for inclusion of information from the People's Biodiversity Register into the TKDL database. Question number 59. India's first Global Ayush Investment and Innovation Summit 2022 was held in option A, Jamnagar, Gujarat. Option B, New Delhi. Option C, Jaipur, Rajasthan. Option D, Gandhinagar, Gujarat. The correct answer is option D, Gandhinagar, Gujarat. India's first Global Ayush Investment and Innovation Summit 2022 was held in Gandhinagar, Gujarat, and it was held from 20 to 22nd April 2022. And it has investment, innovation, and entrepreneurship areas, and 6 plenary sessions, 8 roundtables, 6 workshops, 2 symposium, and 90 eminent speakers and 100 exhibitors were there in the Global Ayush Investment and Innovation Summit 2022. Indian Prime Minister Sri Narendra Modi inaugurated the Global Ayush Innovation and Investment Summit at Mahatma Mandir in Gandhinagar, Gujarat, in the presence of Mr. Pravin Kumar, Prime Minister of Mauritius, and Dr. Tedros Ghebreyesus, Director General, World Health Organization. The national partners of Global Ayush Innovation and Investment Summit are Confederation of Indian Industry and Institute for Teaching and Research in Ayurveda. The event brings together the country's key startups, entrepreneurs, investors, policymakers, and other national and international stakeholders for a specially curated event on innovation in the Ayush sector and making India a global Ayush destination for entrepreneurship and innovations. And during Global Ayush Innovation and Investment Summit, A letter of intent over rupees 9,000 crore came across significant categories like fast-moving consumer goods, FMCGs, medical value travel and services, pharmaceuticals, technology and diagnostics, and farmers and agriculture. Global Summit witnessed more than 70 memoranda of understanding signed between countries, esteemed research institutes and organizations, farmer groups, and industries. And this event is the endeavor of Government of India to develop India as the hub for traditional medicine practices, which will guide the world toward attaining better health and lifestyle. Question number 60. Which among the following is associated with Professor Ayushman Yoga Special Comic Book? Option A, Morarji Desai National Institute of Yoga. Option B, National Medicinal Plants Board. Option C, All India Institute of Ayurveda. Option D, both A and B. The correct answer is both A and B. Professor Ayushman Yoga Special Comic Book was launched on the occasion of International Day of Yoga in 2024. And this comic book was created with characters and stories to guide young readers and to create awareness among children regarding yoga and to educate the people of all ages the importance of yoga in daily life. And Professor Ayushman Yoga Special Comic Book was prepared by the joint efforts of National Medicinal Plants Board, NMPB, and Morarji Desai National Institute of Yoga, MDNIY. And the comic book was funded by National Medicinal Plants Board. Thank you.